to increase scapular depression. How many people have their scapulas, their shoulders wrapped up around their ears with all the stress these days? So let the scap just drop down. The head is anchoring on a pillow using the counter force of gravity. And I can apply a little distraction by grasping the distal humerus. At the same time, you get a nice stretch opening up. Now if they start complaining about tingling or numbness in their fingers, sometimes there's some adverse neural tension. You'd want to do an upper extremity tension test to check for that to see if you're reproducing the symptoms. But I like to take them just to the point just before they get some of that little tingly sensation. If it's tingling too much, back off. Get a little break at the elbow so you don't have the tension across that median nerve there. I can anchor at the occiput to get additional stretch. I could anchor at the acromion to get a little scapular depression. I could do a little distraction from the distal humerus and open up that whole shoulder capsule. And you can then add some different motions to that, opening it up with extension, opening it up with flexion, opening up with some abduction. So take them to the point where they are limited. Say she had a frozen shoulder and she's limited at that halfway point, distracting and holding with the scapular depression. But that distraction will be necessary because they'll tend to impinge at the glenohumeral joint where that greater tubercle becomes impacted under the acromion. So that distraction, I can even palpate that greater tubercle here at the shoulder and feel if it's impacting or distracting. So distract it down as you come through a range of motion. You can start letting them come up into a little bit greater abduction, bring them to the point of their restriction, and then you can add a little bit of that hold, relax muscle energy. So I'm going to ask you to pull this arm down toward your waist just really lightly when I say go. Ready, go. Pull down really lightly. So I'm resisting adduction and relax, 2 or 3 seconds, and stretch, take up the slack, moving more into abduction. So say you meet the new barrier, wait at the barrier, provide the distracting force, keep that scap coming back because they love to bring their scap up and forward. Pull down toward your waist again, so resist adduction and relax. And as the adductors relax, they allow you to move more into abduction. Make sure too, as you're going more into abduction, notice I changed my body position. I'm adding some external rotation of her shoulder to help clear the acromion at this point. And now bring your elbow toward your waist again. It's always giving something to aim at and relax. Distraction, elevation into abduction. And I'm monitoring that glenohumeral joint. I'm stabilizing the scap at the same time. Patient's breathing, which is always great. As they have greater ranges, you can then cradle the patient's arm underneath your arm. Get a nice purchase on the distal humerus. Now we find many times as you come into those higher levels of elevation, the pec major, the latissimus, teres major coming along the lateral border of the scapula. Remember that latissimus dorsi comes down and attaches all the way into that iliac lumbar dorsal fascia here to the iliac crest. So I like to anchor, get some gripping from the distal humerus, pin down that scapular border and get some nice stretch into the teres major and the lats. Remember to keep that distracting force on as well to open up the joint and get some myofascial release to the joint capsule. You can also use the handhold coming down across the ribs and then gradually even to the iliac crest to get a little bit more of a stretch into latissimus dorsi. And to add that hold relax, what can you do? You could resist whatever those muscles do. So lats and teres major would be the shoulder extension resisted, or easily I can do some hip hiking. Hike your hip up into my hand right here and relax. And it should be isometric. She's doing a lot of work. If you're just very, very light, and then stretch more into a new range of motion. So a nice way to get some increased shoulder elevation from a sideline position where patients are often more comfortable.